You know, presidents will come and go, but our mission will continue. And that mission is clear: advancing our practice and securing our future. You know, as presidents, we don't have our own personal agenda. Rather, we use as our guide the ASA strategic plans set forth by our Administrative Council, our Board of Directors, and our House of Delegates. Team is a word that you've already heard a lot this morning, but that is a word that describes our approach to this past year. And you know, the word team is actually just an acronym. It stands for Together, Everyone Achieves More. And we proved that to be true time and time again over this last year. All of the work that's been accomplished this year was done by a team of volunteer or elected physician leadership, partnering with our staff to accomplish a goal. Everything I will discuss today, everything we accomplished, everything still being planned and proposed, all of those things are the result of teamwork in the pursuit of a common goal. So please allow me to share a few examples of teamwork from this past year. Our new headquarters building is a perfect example of that teamwork. Spanning 6 presidencies and 2 ad hoc committees chaired by John Neild and then Steve Sween, the site selection and the building itself represent teamwork at its finest. Our new building is emblematic of our specialty, an incredibly rich history brought back to life in this new building. Our futuristic, state-of-the-art headquarters will serve our membership and our staff well for decades to come. Equally important as the physical structure of our new headquarters is the staff team that works in this new building. This is the first full year of our staff team being led by a single CEO, Paul Pomerantz. He has served us well. Thank you, Paul. What a terrific team you're leading with Tom Conway, our COO, and Jeremy Lewin, our General Counsel. In regards to our response to the creation of a VA nursing handbook, ASA's teamwork led by Manny Bonilla and Nora Matus involved partnering with internal and external stakeholders within the VA and legislative and regulatory committees of jurisdiction over veteran affairs and with veteran service organizations. We undertook all of this to call attention to the critical patient safety concerns for our veterans in need of surgery and anesthesia care. One would think that with all the problems the VA has faced in recent months, they would be reluctant to make yet another decision that could potentially put them on the front page with negative headlines. We will continue to work to ensure that veterans have access to the physician-led care they deserve. Our steering committee for our perioperative surgical home, or PSH, first led by Dan Cole and now Stan Stead, is yet another example of teamwork. As you know, our PSH concept development of surgical and procedural care coordination involves several ASA committees crossing all 3 divisions within ASA. In addition to the teamwork between our physicians and our staff to develop this concept, we've also partnered with Premier to initiate a learning collaborative, and we have involved over 40 healthcare institutions around the country. The PSH defines our future as a medical specialty. It is what sets us apart and what will help secure our future opportunities and our impact. PSH must be at the heart of our education and training programs and at the core of our individual practices, no matter the practice setting. We will not implement it overnight, but implement it we must if we are to survive and thrive in this changing healthcare environment. Another great example of teamwork has been witnessed on our ASA PAC board, and you've heard that report, between our physician leaders led by Jeff Mueller and our staff led by Michelle Matthey. What terrific progress we have made. However, think how much more we could accomplish if we had 50% or 75%, let alone 100% membership on our ASA PAC team. An exciting example of teamwork has been the newly formed partnership between the ASA and the ABA in order to assure that ASA remains the go-to resource for professional education and lifelong learning. This work is just beginning. Another priority this year that has involved teamwork between our physician leadership and our staff is the work of our Subspecialty Society Steering Committee, led by Bev Phillip. As you know, our subspecialties are involved in the activities of several ASA committees crossing 2 of our divisions. The focus this year has been on the transition from operational management to relationship building. Please make sure to visit our subspecialty pavilion on the exhibit floor. The team theme with our subspecialties is very simple. You know, we have far more in common that unites us than the few factors that might divide us. We share common goals. In short, we are all in this together, and team, together everyone achieves more. We had a home run this past year from an activity started in 2008. Our Anesthesia Quality Institute, under the leadership of Rick Dutton, gained recognition from CMS as a Qualified Clinical Data Registry, or QCDR. What a game changer this will be for all of our members relative to payment related to quality data reporting. What a great example of teamwork between our physicians and our AQI staff. Our membership team has and continues to be a major focus. We have tasked our membership committee, led by Linda Mason, with redefining ASA member value, and we have a new ad hoc committee to focus solely on our geographic components. These 2 activities will allow us to better serve our current members and hopefully attract new members. Because of the critical importance of teamwork between our physicians and our governance staff, we have spent much time, energy, and effort this past year on improving our onboarding process. This orientation process is underway at all levels within our organization, including at the committee level, the House level, the board level, and the elected leadership levels. And this has all been led by Ms. Michelle Campbell. A special thank you goes to both Michelle Campbell and April Cheek for their support of this year's activities involving the EC, the AC, the board, and the House. Equally important as teamwork is the critical role of communications. We certainly know that to be the case in patient care. It is also the case in organized medicine. I hope that you have noticed our ongoing efforts at improving communications at all levels, both internal and external to our organization. From the weekly EC to AC updates, the monthly EC to board updates, and the every other month EC to House updates, we realize that the more knowledgeable our membership, the more everyone achieves. Our goal is to make ASA's communication tools attractive, useful, and effective. And you know, nothing exemplifies that more than our When Seconds Count education endeavor. Many thanks go to Ken Elmasian and Teresa Hill, our Director for Communications, for their lead in this role. A critical part of our anesthesiology team is represented by our foundations. Partnering with representatives from each of our foundations, ad hoc committees, first led by Jim Grant and now Mary Dale Peterson, have and will continue to work on recommendations to maximize funding, share resources, and enhance unity of thought. In these changing times, the medical specialty that fails to anticipate and plan will lag behind. ASA will not lag. We will lead. So that is the year in just a few words, but I must conclude with just a few more personal comments. You know, it's Helen Keller who once said, "Alone we can do so little, but together we can do so much." The ASA presidency is not about a single individual. Rather, it is a collective vision we all share for the patients we serve, for the specialty of anesthesiology, and for our profession of medicine. It's all about the team. Together, everyone achieves more. Each and every one of you is to be thanked for your role on Team ASA. So this week, I'm going to pass on my duties to JP, just as he will pass them on to Dan in 12 short months. So to JP and Dan and to John, thank you for your teamwork over this past year. And to the members of the AC, thank you for your wise counsel. It has been such a treat to work with such a talented team of physicians and staff. I know that for those who follow, They will be inspired by what I have come to witness firsthand these last 3 years, that we truly have the best physician leaders, the best staff, the best medical specialty in all of medicine, and the best medical specialty organization. It has truly been the highlight of my professional life to have served as your leader on Team ASA. Thank you, and bless you all.